Thank you, Jema. I'm also happy to welcome everyone to our second cardiac safety symposium here. So this is the second of the annual series. We had our first symposium in 2021. So, well, over the years, we actually did. We did come a long way over the last couple of years. So we, and I'm speaking here on behalf of the global cardiac researchers and the cardiac safety community. We had quite a lot of recent publications from electrophysiologists looking at iPS-derived cardiomyocytes and native cells, looking at patch length measurements using the SEPA protocol, best practice publications derived from the SEPA studies, and also calibration of pro-arrhythmia risk prediction models from the FDA. Also news from the implementation working group regarding the new ICH E14 S7B guidelines, just to name a few examples here. And we will also hear from some of the authors here today. So taking a step back, more than 10 years ago already, Yamanaka et al. Earned the Nobel Prize for the discovery that mature cells can be reprogrammed to become pluripotent. And this discovery changed a lot. Also, of course, for cardiac applications. So now I have a little interesting information collected here, which is the development of peer-reviewed original articles around stem cell-derived cardiomyocytes over the years. So obviously from 2012, there was a steep increase of the number of papers published per year. And most of the publications come from the US, but also quite a lot from China, Germany, and then Japan as well. Here you see the distribution across countries. So about 40% of the articles come from the US. Furthermore, more than 70 countries contribute to these publications, which means also more than 20,000 researchers contribute to all of these manuscripts. Now, a shout out here to Artem, who is running the ionchannellibrary.com website. He was doing this research here on the literature, and you will find a lot more meaningful and interesting information on his website, so check it out. Now, quite some of those publications are authored by researchers who are also part of the HESI Cardiac Safety Committee. So the mission here of this committee is to improve public health by reducing cardiovascular-related side effects from drugs and to develop innovative approaches to support cardiac safety measurements. In the stem cell working group, which is co-chaired by Ksenia Blinova from the FDA and Godfrey Smith from Clyde Bio, University of Glasgow, there is currently the chronic CardioTox study ongoing, and we will hear about this study in multiple presentations today. So speaking about innovative approaches and technologies, I would like to highlight this video protocol collection here from JoVe. So the guest editors here were Ksenia again from the FDA and Jennifer Pearson, who is an associate director at HESI. And this collection here addresses different cell models like single cells, 2D or engineered heart tissues, primary cells, iPS cardiomyocytes as well, And the approaches and assays reveal diverse endpoints, such as contractility, electrophysiologic readouts, or calcium fluorescence. Today, we will hear a bit about flex-side mature contraction force measurements as well, for example. So coming back to the HESI chronic CardioTox study, these are the compounds being investigated in the study, listed here with their mechanism of action. And we will hear from Khurram about the study efforts itself, but also we will hear from Bettina about the chronic toxicity and effects of those compounds on a cardiac cell model. And now, in order to pave the way for some of the results being shown today, I'm making a little detour, and I give you a brief introduction to the company I work with, Nanion Technologies, and also to the portfolio and technology that we develop and provide. So, well, we also came a long way. We celebrated our 20th anniversary last year, and starting in 2002, we developed automated patch lamp devices like the Porter patch, patch liner, or the Synchro patch, and also cell analytics systems like the CardioTox and the flex-side. And these systems are also part of the HESI study, for example. Now, as I said, we will hear about some contractility measurements today with CardioTox flex-side. We will also hear about some synchro patch measurements, some automated patch clamping today. And now I'm really happy to announce a new development that Nanion is just around the corner to launch. This is the Atlas system. Now, the system is a impedance-based cell analysis system in a 6x96 well format. It allows for real-time cell analysis in a label-free manner. It automatically is graphing your results, and in general, it is a very easy-to-use system. So with the Atlas, you can tackle a huge variety of research areas, such as immuno-oncology, cell proliferation, or CAR T cells. So anything which is important for cancer research, for example. Also virology, GPCR, or barrier functionalities, just to name a few here. So regarding the setup, you have the recording unit standing in your own incubator. Then there's a control unit, a laptop coming with it, and a barcode scanner for your measurement plates. And the system actually is capable of deciphering complex cell responses in a continuous manner. So, for example, in comparison to endpoint assays where you receive only one single data point, with the Atlas system, you can generate or you can monitor your cell signal over time continuously. And this has the advantage that you also see the kinetics of your compound effect of your cell response. Now, the very well established methodology behind the system is electrical impedance spectroscopy. So impedance spectroscopy allows to monitor a large variety of effects in cells over time in parallel. Because depending on your readout frequency, which you see here, either cell layer is that barrier integrity or cell death is monitored at the same time. So this means the system allows for a unique richness of information that you can gain from your cells. Now, ready to go recording modes with automated graphing of results is available for ease of use. Furthermore, exporting of raw data and final figures is also possible. Now again, coming back to the HESI compounds from the CardioTox study, we will later on see analysis on whether the cell integrity of cardiac-like cells is impaired or not upon chronic exposure of these compounds. And I'm very much looking forward to that talk and as well to all of the other talks. And I guess now it's time to hand over to my colleague Ellie, who will be introducing our first speaker.